everybody to Access Health Connecticut. Here's our Healthy Chat here, held this afternoon at our really beautiful Eno Memorial Hall in Simsbury, Connecticut. If you haven't been here before, it's really a beautiful building in Simsbury that we're so proud of. I'm Charity Folk, and I'm the Executive Director of the Simsbury Chamber of Commerce. And earlier this year, I reached out to Access Health Connecticut and asked them if they would schedule a Healthy Chat here in Simsbury. With the new Affordable Care Act almost upon us and enrollment starting in October, it's really, really important that we as employers, employees, individuals, and families understand how our new regulations will be affecting us. So I'm very pleased that the Simsbury Chamber of Commerce is able to present today's Healthy Chat, where you will learn how healthcare reform will impact you, find out the progress with Connecticut's health insurance exchange, and also find out exchange, what does that mean, and the enrollment process. And after today's presentation, there'll be opportunities for questions and answers. Today's presentation is also being taped by Simsbury Community TV for future cablecast. So with us today from Access Health Connecticut is Jason Madrak, who joined Access Health Connecticut in May of 2012 as the Director of Marketing and Communications, and was later named Chief Marketing Officer. Jason brings with us 15 years of diverse experience in media and marketing leadership in the finance, insurance, and consumer products industry. And most recently, Jason held senior leadership positions with WellPoint and Aetna. And in April 2012, recently, Access Health Connecticut named Phil Boyle as its business-to-business outreach manager. Mr. Boyle, who brings 18 years of insurance experience to the position, joins Access Health Connecticut from Pearson & Smith, a division of First Niagara Risk Management. And gentlemen, the program is now yours. Thank you.
Thanks. Great. Well, thanks so much. It's a privilege to be here today. Really appreciate the invitation to come out and speak with all of you and hopefully give you an update and an overview of Connecticut's new health insurance exchange. Connecticut's been at this insurance exchange business now for some time. We actually got started in June of 2011, so this is coming up quickly on our 2-year mark. In June of 2011, that's when the Connecticut State Legislature actually passed the founding statute to legally go ahead and get the insurance exchange off the ground. Coming out of that, we spent the better part of that first year really getting all of the mechanics set up in order to make sure that we could bring folks on board, to make sure that we had a place to actually house everybody, and all the mechanics that you might imagine go into setting up an organization. So it very much had the feel of a startup. And so coming out of that second year, that's when we really kind of rolled our sleeves up and began to dive deep into making sure that we began setting up all of the mechanics that it's necessary to put in place in order to actually make an exchange begin operating. And so there is a fairly heavy IT component to that, which I'll talk about in a little bit. We started to get some of our marketing and communications work up and running. We started to get some of the work related to just our own internal operations up and running, setting up a call center, and a whole host of other things which really form the bulk of the work that we're focused on right now in order to make sure that we are up and running as of October of this year, which is our go live date. Folks coming to the exchange on October 1st will be able to look at a whole array of different options, which we'll spend some time talking about here. Make a selection and physically enroll in coverage. If they enroll during that fourth quarter time period, their coverage will begin January 1st, and they'll be able to start the year as a covered individual. The program that we have here for you today is actually divided up into two parts. The very first part will be a brief presentation that both Phil and I will give to really just cover off on some of the basics around what the exchange is, how it operates, and how it actually affects individuals and small businesses. We're going to keep that pretty brief. It'll be about a 20-minute presentation. And then actually the second part of our time together will actually be spent in a Q&A fashion. And so we found that it's most helpful to actually just hear your questions directly and hopefully Phil and I will be able to provide some information to answer those questions. And if you don't, and if we can't, which sometimes happens, we'll make sure that we actually circle back with you guys once we go back and find the answer, so we can get you the information that you need. So we'll start pretty basic, and this is actually a question which I get still even to this day, and quite simply that is, what is an insurance exchange? When you use the word health, insurance, and exchange all in one sentence, people tend to get kind of confused. Folks sometimes confuse it with a stock exchange, that there's some sort of financial transactions there. Other people think it's a physical location where they have to bring something in, and obviously none of those answers are correct. The health insurance exchange here in Connecticut is really a new marketplace, and it's a marketplace that connects buyers and sellers. In this case, the sellers are the private insurance companies that many of you already know. It's the Aetnas, it's the United Healths, the Connecticares, and the buyers are customers. Many of you here, people you might know, people in your family, on both an individual level as well as on a small employer level. And so again, a marketplace is typically a place where buyers and sellers can come together, and that's exactly what we're doing. Many times folks look for an analogy, and the best one that I can give you is one that other people use as well, is it tends to be almost like a Travelocity for health insurance. And so if you think about Travelocity, typically what happens is you go on the computer, you type in a little bit of information about where you're going and when, the computer spits back a couple of options for you, you're able to select one, and actually go ahead and purchase that product right on the site. And in many ways, it might oversimplify it a bit, the experience that we're putting together for Connecticut is very similar. You'll be able to go on, put a couple pieces of information in, see the plans that might be available, and actually go ahead and transact and purchase those insurance products right on our site. There's a couple of different things that are going to take place on the site that are unique to the exchange, which you can only find there, and we'll talk about that in just a little bit. The last thing here is, the reason that this new marketplace is so important is it actually is kind of leveling the playing field and setting up a new marketplace where there will actually be some competition in terms of competing for customers, and certainly competing on the basis of price and also price transparency. I think if anybody here has ever shopped for insurance themselves, or helped a loved one or a neighbor to shop for insurance, it can be very confusing. Many times you have to go to several sites, you might have to make several phone calls. Usually you need the help of a professional to come on in and help you make that decision. And then even when you have all that assistance, many times trying to decipher the difference between product A and product B with some cryptic names and all kinds of different deductible levels and price points, it's always a big challenge for folks to really determine or make an apples-to-apples comparison in an effort to go ahead and make an educated choice and get the product that might be best for them. There are several components that the exchange is introducing to make sure that that experience is dramatically improved. And I'll give you one example of what one of those is that really is going to be transformative here. The exchange has set up some standard benefit designs for the plans that are going to be offered on the exchange. And a standard benefit design is very much what it sounds like. It's a standardized package of benefits that all carriers will be setting up and pricing. And so you may have heard before that there are different metal tiers within the exchange. These tiers are based on the Olympic system of bronze, silver, gold, and platinum. And those are really just a more kind of consumer-friendly way to help individuals determine the level of coverage that they might be getting. So obviously, if you're getting a platinum level plan, the amount of coverage that you would receive there would be much different than what you'd get at a bronze level plan. And rest assured, the bronze level plan is a fantastic plan with excellent coverage. Just because it happens to be the lowest tier does not mean that it doesn't offer excellent benefits. But in each one of those different tiers, there'll be a standard benefit design. And so as carriers go ahead and list their products on the exchange, they'll need to file a plan in that standard benefit design. Now, if it's the same plan, ostensibly that means that there's only a handful of variables that can actually be different. And those are primarily, one, the brand of the carrier and the person who's actually selling it. Two, there could be some network differentiations based on who those carriers are actually contracting with to build out their network for those plans. And then third, and most important to consumers, is the price. And so with all of the complexities of an insurance product being relatively standardized and only a few variables really being different between the carriers' offerings, it should make it much easier for individuals to go ahead and evaluate these plans so they can, again, truly see an apples-to-apples comparison across carriers on those tiers rather than trying to decipher through a whole network of different copays and deductibles and all sorts of complexities that typically exist. So this should offer a much more simplified and user-friendly experience to go ahead and purchase these products through. We're here today to talk about the health insurance exchange. I'm not going to go into any great detail around the Affordable Care Act, other than to say two primary things. One, obviously the exchange is coming out of the Affordable Care Act. You are going to be required to set up an exchange. If states choose not to set up an exchange, the federal government will go ahead and set one up for you. Connecticut is one of 18 states, including the District of Columbia, that have gone forward and made the decision to set up an exchange at the state level. The remaining states, for the most part, have all defaulted to let the federal government come in and run the exchange on behalf of their state for their citizens. Connecticut was actually one of the very first 6 states to be approved as a state-based exchange, and was also one of the very first states, again, the first 6, to be approved for federal funding to go ahead and go ahead and set up all the operations that I mentioned earlier to get this whole system off the ground. The other thing that I'll raise just around the Affordable Care Act is that the exchange is being set up against a backdrop of extremely transformative market changes per the statute and the bill that was passed. And I'll give you just a few examples just to talk about how transformative this type of change is in this particular market. So, if anybody here has ever tried to apply for an insurance product in the past, know someone who's tried to, help someone try to apply in the past, the application and the process of applying is very arduous. And in many cases, you have to supply a whole bunch of information around past medical procedures you might have had, medications you might be taking. It can be very intrusive, it can be a very lengthy process, and it can actually be quite intrusive and a little bit scary to consumers to have to go through and disclose that type of information. That's typically referred to as medical underwriting, and that information is typically used to go ahead and price the plan that an individual would be purchasing. And obviously, if you have certain types of conditions, that price could be higher than if you didn't. That entire process of medical underwriting is gone. And that's a practice that's been in place literally for decades in this industry. But with the Affordable Care Act, you can no longer have to go through that process and supply that type of information. Quite honestly, it's nobody's business about anything that happened in the past related to your medical history. I'll give you another example. Gender rating. Today, typically, men and women will pay different prices for the exact same product. Gender rating is now gone. You can no longer differentiate prices based on whether you're a male or a female. Pre-existing conditions. A lot of folks who need care the most and access to health insurance the most were unable to get it because they had some sort of condition which would be deemed pre-existing, and they would be excluded from being able to access care or access health insurance. That also is now gone as well. So the list goes on and on. Obviously, the document is several hundred pages long, and there's a list as long as my arm of different changes. But I only mention these few just to kind of underscore the fact that these are practices that have been in place for decades in this industry that are now not part of the system. And that is transformative, it's dramatic, and it's going to take a little while to see how these types of changes and this level of disruption is going to affect this marketplace as we move forward. I'll spend a few minutes here just to go through the process of actually how the exchange physically works. It's a stepwise process. There's 6 steps that are listed here, and we'll start at the beginning. So the very first stage is to come to the website and go ahead and provide us with just a few basic pieces of information. Basically, that is telling us where you live, and maybe if you're shopping as an individual, or maybe you're shopping as a business, or maybe you're shopping for a family. That's going to help to make sure that the options that are served up are germane to what you might be looking for. Outside of that, you really don't need anything else to just start the investigation process. If you're curious, you don't have to provide a Social Security number. You don't have to provide any sort of detailed information. You can just start shopping. And obviously, there's going to be a lot of people who are very curious regarding what types of products and services are available. And so this is a way just to get that ball started rolling without any sort of intrusive process. Once you go through, you'll be able to take a look at all the different plans that are available. And right now, we do have letters of intent from 5 major carriers here in the state to go ahead and list products on the exchange. Those carriers are Aetna, Anthem Blue Cross Blue Shield, Connecticut, United, and the brand new nonprofit co-op plan, which is being put together by a group of doctors here in the state called Healthy CT. That will be a new entrant here into the Connecticut market, and they will also be listing products on the exchange as well. So 5 carriers will be available. As I mentioned before, the carriers will need to provide a plan design within the context of those standard benefit designs at each of the tiers that I mentioned before. But in order to make sure that we are encouraging some innovation and creativity, the carriers are also allowed to list an additional plan that might not be in that standard design, but certainly meets the requirements of the coverage levels in each of those metal tiers that I mentioned before: bronze, silver, gold, and platinum. And so in total, you've got 4 tiers, 2 products from 5 carriers. It's a little late in the day, so my math might be a little off, but that'll give you a basic idea for how many plans you might see when you come to the exchange come this October. If you like what you see and you've got something that seems to kind of meet your needs, you'll be able to then go into the actual application process. And so through that process, we're going to need to start gathering just a bit more information. And this information primarily relates to some income information, household configuration information, exactly who you're applying for. And the goal of this is twofold. 1, to make sure that we can provide that information to actually enroll you in coverage. But 2, and more importantly, there are a host of different tax incentives in place to hopefully, for many individuals, lower the cost of the premium for these individuals on a monthly basis and make the plans here more accessible and hopefully more affordable for those individuals. In your packet, there is a detailed chart that actually shows different household sizes and different income breaks, and then what the actual monthly premium might look like for those different types of individual configurations. I won't go through each box on that chart in detail, but I will just go ahead and give you a general overview of how this system works. For individuals today who are in between 138 and 400% of the federal poverty line, they will be eligible for tax incentives to make the price of their plan more affordable. Now, what the heck does 138% of the federal poverty line mean? There's a specific number there in your table, but it equates loosely for an individual to around $15,000 or so. And then that extends all the way up to 400%, which loosely is about $42,000 to $43,000 for an individual. And obviously, the greater your family size, those numbers would actually increase as well. Again, family of 4 at the 400% of FPL level, that equates to about $92,000 to $93,000. So it's casting a pretty broad net and really bringing a lot of people in who typically don't qualify for these types of incentives, but now offer some assistance to make these plans more affordable for them on a monthly basis. In between that 138 and 400% of FPL range, there are also some premium caps which are put in place per the Affordable Care Act. Now, premium caps say that at certain levels along that continuum from 138 to 400, you'll never be able to pay more than a certain percent of your modified adjusted gross income towards the cost of a health insurance premium on an annual basis. At the 138 mark, that number equates roughly to about 2.5%, and moving up to the 400% mark, it equates to about 9.5% on an annual basis. Now, to go back down to that 138 mark, clearly 2.5% of someone who's making $15,000, that doesn't come close to covering the cost of a typical insurance premium on an annual basis. And so it's these tax incentives and tax credits that are available that actually make up the difference between what they would pay, which is that 2% mark, up to the cost of the actual price of the premium for that plan. So to just put that into a little bit different perspective, let's say hypothetically the price of a plan is $600 a month. I'm going to make this up just by way of example. And at the 2% mark, it comes out to roughly $100 a month for an individual in terms of their contribution level. The cost of that plan is $600. The individual will receive a bill from the carrier for $100, and the $500 delta between the individual's contribution and the ultimate plan would actually be paid for by the federal government directly to the carriers to make them whole for the price of that plan. So from a consumer standpoint, now they're entitled to these tax credits to offset the price of that premium. It's done on a monthly basis, so individuals don't have to pay an exorbitant amount of money out of pocket each and every month and then reconcile it back at the end of the year. It happens on a monthly basis to make sure that individuals can access this more appropriately and make it a little bit easier for them to go ahead and get this type of care. That's one of the main reasons that we're getting this financial information in order to verify who's eligible for these types of incentives. All the information that gets provided, whether it's your Social Security number and some information about your family, whether it's the income information, is all verified. And this verification process takes place through a federal data hub. So right now, many of our counterparts on the federal side are getting together and putting together a single entity which will be able to go ahead and ping entities like the IRS, entities like Homeland Security to verify citizenship, and about 11 other different entities in one spot, so that we can verify this information in terms of its accuracy, and also for security purposes, and then actually feed back information to the individuals applying regarding what they may or may not be eligible for in these tax credit arenas. Once that information has been verified, you'll go ahead and select the plan option that you looked at potentially earlier when you were anonymously shopping. And at that point, the enrollment process is complete. So you would hit submit. That information would then go to the carrier that you selected for your plan. And at that point, you would enter into their standard post-enrollment process. You'd probably get a member handbook of some kind. You'd get an ID card in a little bit, and you'd be a full-fledged member of those particular carriers' plans. Now, this is a dramatically simplified view. I'll go through this one more time to say two things. One is this system will also be determining eligibility for Medicaid products here in Connecticut. So a lot of times you'll hear this term, no wrong door, and no wrong door in the case of the exchange means that individuals can come to one spot and find out not only if they're eligible for the tax credits that I just mentioned, but they may also be eligible for state programs such as Medicaid, such as Husky for their children, and that eligibility will actually be determined with the same information that I just talked about. And at the end of the day, if it's determined that they actually qualify for Medicaid, they can facilitate that enrollment right here on the site, hit submit, and that process will be complete here. The other thing, obviously, there is a small business component, which we'll talk about in a bit more detail. Small businesses would also be able to come to the site and go through the process of evaluating plans, selecting which plans that they would like to offer to their employees, and then setting up a way for their employees to come on and make a selection and sign up for coverage, again, through the exchange. Two last key points. The tax incentives that I just talked about for individuals are only available through the exchange. Currently today, you can buy a product direct from a carrier, and that's somewhat simplified. But if you want to take advantage and you do qualify for tax credits, you will only be able to get those by shopping and enrolling through coverage through the exchange. On the small business side, there are also tax incentives in place, which again are only available through the exchange. We'll talk about that in a little bit more, and actually I'll let Phil fill you in on some of the details around the small business tax credit process. And then lastly, and I'll also let Phil cover this is where we'll make our transition. You know, we spend an awful lot of time talking about the exchange website, but there are several other ways for individuals to act or interact with the exchange, and I'll actually turn it over to Phil to go ahead and take us through some of those details.
Thanks, Rex. Good afternoon, everyone. My name is Phil Boyle, and this is hour number 10 for me at the exchange. I've just come on board, and I'm very happy to be on board. It's an exciting time in our state for having this being built. This is a lot. I will tell you this. I've been doing this. I've been in the insurance business for over 20 years, and this is a whole new dynamic. This is a big program being instituted. I was one of the losers who read over the 900 pages when the law passed. I didn't read every word. I won't put my hand on a Bible and say that. But I did read a lot. So I know I've been out educating people for 2 years. about what's coming. And I just always see crowds, and I always just kind of tell them, take a deep breath, we're going to get through this. So I just want to start off by saying that. Oh, am I going the wrong way? I'm sorry, my life going the wrong way. So, as Jason said, you know, there's a lot here. Jason talked a lot about the individual side. I'm also going to talk about the shop and how we're going to come through this. So, you know, the one thing that I would say is a lot of people always ask me, what is an exchange? Is it a building? Do you go to Hartford and sign up for, you know, an application? It's really just a web portal that people are going to go to and be able to access the information. There is right now in Massachusetts something called the connector. If you want to see an example of what an exchange is going to look like in terms of a web portal, I would kind of recommend that you go there. And same as Jason said, you can go on and kind of play around. There won't be the same carriers up there. It'll be Tufts and Harvard Pilgrim. But if you want to kind of see what they do, you can anonymously go on there and plug in your information, and it'll kick out, you know, 74 different options. So you can kind of see what the future will look like here in the state of Connecticut. When you come to the exchange, you're going to come in through, as Jason said, no wrong door, but you're also going to need some help. There are going to be a number of ways. Primarily, the primary way that most people that are businesses, and I'll talk to businesses specifically, get their information is through brokers, producers, brokers, agents. And that is going to continue. We are very strong, and I come from that background. I was a broker for a number of years, and I do believe that this is not easy, and it is complicated, and you will need help. So a broker will be available to help you to navigate, to use that terminology, onto the exchange. Because again, even though you're going to have, you know, the different carriers, you're still going to need help understanding the difference between a bronze plan, a silver plan, and things like that. There's also going to be a new group helping people. Now we're going to kind of go back to the individual. They're called navigators. These are people who are going to kind of facilitate getting information out there. They're not going to really sell insurance. They're going to support and educate people about the plans that are available in the exchanges. So they're navigators. This is a brand new world that we're in, so they don't exist, so to speak, today. We did see them exist up in Massachusetts. They did help people that just weren't approached by other organizations. So they are also going to be available. So I talked about that. And then we are going to have a call center. It's very important, you know, when people call in to have help and you know, just get the answers that they need to have. So there is a call center being set up, and this is a group that's going to be able to expedite information and get information out to people accordingly. So I think I covered that. Yep, I'll let you. Yep, please jump in if you need to.
Yeah, I can. Actually, if you'd like, just cover the business tax credits.
Okay, so as Jason mentioned, there is business tax credits available to companies in the exchange only. There are 53,000 businesses in the state of Connecticut that are eligible for these tax credits. And what it is it does depend on the size of your company, and what we're talking about mostly is companies with 25 or less employees. They have to earn, the employees have to earn a certain dollar amount, and if you go to irs.gov and look up the information, it is there in terms of the dollar amount that they are eligible for. The other thing I would point out to you, when you're looking at the employees who are eligible, you do not include the owners of the companies, of S chapter, corporations, LLCs, or PCs. They are excluded from that equation. But based on that information, you would see that you would be eligible for some of the tax subsidies credits up to 35% for the for-profit companies and 25% for the not-for-profit companies. So that's just a high overview of that. I'll let you.
And then I'll just round it out here, and then actually we'll close out the upfront portion and really open it up for questions. So, you know, moving ahead, you know, our vision for the future is really kind of fivefold. The first is really to introduce a brand new, consumer-friendly, user-centric process for individuals to access and get health insurance information. I think, you know, anybody who's ever had to enter this world on their own, you know, would probably agree that it's a challenging process. And so by creating a really centralized centralized place for folks to come, get information, and actually be able to facilitate these types of complex transactions is really going to hopefully be quite helpful to thousands and thousands of our fellow citizens. Obviously, we would like to reduce the level of the uninsured here in Connecticut. Connecticut right now is a state of about 3.5 million people. We have about 350,000 uninsured. So our uninsured rate, toggles between 9 and 10%, and that's probably 9 or 10% too many. And so hopefully with some of the programs that we talked about as it relates to tax incentives, with the new web system in place, with the call centers, brokers, navigators, assisters all working in tandem, we can make a sizable dent in that during this initial enrollment period, and certainly we'll be working very diligently in years ahead to make sure we continue to ratchet that down. Providing health insurance options. Today, for several individuals, they don't have a lot of choice in this particular marketplace. And so by having a simplified system where we do have name brand quality carriers offering an array of options, that should open up the door for many individuals to have access to more choices in this arena than they may have had in prior periods. Promoting innovation and competition. Again, in this particular marketplace today, you have to go to different places sometimes to get different information, coming up with a more streamlined, more transparent, more simplified system where individuals can evaluate on an apples-to-apples basis insurance products, insurance plans. We think that's actually going to breed some competition and really kind of create a new marketplace and a new arena for carriers to compete for our business in. And then lastly, facilitate some discussion around how to create a more affordable insurance coverage. I can tell you quite candidly that not all of the health insurance marketplace woes are going to be solved come October 1st of this year. This is a large, complicated problem to solve and to address. And really what we're talking about here with the creation of the exchange, some of the policies that have been created, some of these new systems, this is a first step in starting to put forward some very serious reform. I talked a little bit about some of the transformative market changes that are coming into actually the entire national landscape. It's going to take time to see how those things work their way through the system and get incorporated. And so this last bullet point is really meant to say, be patient. We're getting started. This type of change is never easy. It never happens overnight. And in reality, it takes all of us here in this room to express our opinions, our beliefs, our own suggestions on how to make this better. And so conversations like we're having today aren't going to stop come October 1st. In fact, they'll probably escalate. And so, this is the first of many forums to continue to come up with a way to build a better mousetrap and really move things forward in a positive direction for most folks. So we really look forward to doing that as we move ahead. So with that said, we'll stop talking, and actually we'll open it up to Q&A. I know typically the presentation we have here answers a couple questions and inevitably raises even more for individuals. So we'll open it up. We do have a mic over here. If you raise your hand and do have a question, we'll be more than happy to respond.
We are going to use the mic today so that we can catch this on SCTV. And while we're raising hands, one of the questions I have, is the exchange open? And when can we go on and see all the different plans? I heard it might not be till the summer, which is close.
Yep. So right now, with the standard plan designs that I talked about and some other policy decisions in the plan design arena, carriers right now are, sharpening their pencils and putting their visors on and starting to put together what these particular offerings are going to look like. Those plans will have to go through the same process that they have today, which is submitting them to the insurance department so that they can be reviewed and approved. And that process typically takes several months as they comb through the details and evaluate what the offering looks like. So with that said, the plans will begin being submitted shortly. Typically April was the time frame when we would see them starting to get those designs ready and begin submitting them. So that takes us kind of into the summer months, if you will. Against that backdrop, we're also putting together the actual exchange web portal that we talked about where many of these products would be displayed. And so really what we're talking about is late summer, probably around the August September timeframe when people will be able to go on and actually start to get a first glimpse of this. The exchange opens officially on October 1st. That's when you'll actually be able to go in and enroll for coverage. Again, if you sign up for coverage from October through the end of the year, your coverage effective date will be January 1st, just to be clear. Some people assume that if the open enrollment period opens in October, you can get coverage starting in December, but anything in that 3-month window does begin in January 1st. Okay. For this very first year, there is an additional 3-month enrollment period starting at the beginning of the year and going through January, February, and March. So if you don't make a decision during that fourth quarter, there still is some time to go ahead and enroll for coverage during that first quarter. But that first quarter catch-up period goes away after the first time. So moving forward in each subsequent year, it'll always be the fourth quarter of the year.
Okay. I thought I saw, here we go.
Do you have to reapply every year, and are there any limits as to how high the premium can go each year?
So in terms of the premiums, that's between the carriers and the insurance department. So again, the Connecticut Insurance Department has full legal regulatory authority to review products and determine if the rate increases being requested are justified. And there's a whole sea of actuarial experts who go ahead and go through that process. The exchange right now does not, approve the rates per se. That still exists with CID. During the open enrollment period, if you are dissatisfied with the plan that you did have, you can change, and you could go in and select a new product during that time frame. If you are satisfied with your plan and want to continue it for the next year, you can go ahead and re-enroll. And one of the important things about the re-enrollment process is many times people's situation changes throughout the year, and so there's an opportunity there to determine whether or not you qualify for additional credits if you've had a change in the negative sense, or maybe you no longer qualify given the fact that your income may have risen, which is also a good thing. For those types of status changes as well, you can go onto the website throughout the year if you do have a qualifying life event and actually be able to change some of the options that you have. So said differently, if you go ahead and get married, you may want to put a spouse on your plan, and you can go ahead and facilitate that change even if it's not the open enrollment period. If your income drops to 0 because of job loss, you can go to the website and go ahead and make that change and determine what you might now be qualified for. Or conversely, maybe you get a new job and your pay goes up dramatically, you would also want to record and go in and put that information in there as well. So there's a couple of different life events that you might want to update throughout the year, but for most folks, if things stay the same, it's that open enrollment period at the end of the year where they'd make those changes.
Yes, I understand that there's going to be a training for the brokers come July. Can you provide some information on how a broker can possibly obtain information about that?
So actually, good question. Guess what I'm doing here? My job is to work with Jason and the team over at Access Health to create a broker education program. Right now, I don't know if you're familiar, we have Robert Noonan doing some some training right now. There's actually 2 more next week about the basics of what the exchange is and all the information that a broker may need. So there's one in New London, which may be too far away, but then there's one in Meriden, I believe that's Friday. So New London's Thursday and Meriden is on Friday. So that's like step number 1, just kind of the overview of what an exchange is and a lot of what we talked about today. And then there's going to be additional training that because again, it is easy, but it's hard in terms of understanding all the complexities of health insurance and how they're going to be affected, because this is a brave new world for all of us. So that will be coming out in July.
Information for brokers, employees, residents is accesshealthct.com. So would a broker go there to find out where the classes were?
Yep. We'll be posting that.
Is that also the portal for the exchange, or will that be a different website?
No, so right now, Access Health CT is really a consumer and small business information portal. So it's a place where folks can go and actually get access to some of the slides we talked about here and much of the same type of information. Come October, when the shopping and enrollment experience transitions in, that same address will be maintained. You'll just see a different experience when you come to the site because we'll be moving away from a heavy information focus and really toggling over to the shopping and enrollment experience that we just talked about.
Right.
As it relates to the broker or promoting those classes that we just talked about, certainly come back to the site and check. Our plan right now is to begin offering those sometime late June, early July, but we'll also make sure we have a promotional program in place working with an organization like NAHU, for example, to make sure that they're alerting their members that this type of training is happening. We would certainly have a press release strategy to make sure that we were informing individuals that way. And certainly anybody who signed up on your way in here with the email, we certainly blast out to our email distribution list anytime those types of training classes are available. The last thing I'd mention just on this topic, because it's an important one, so I appreciate your question, is if you do want to enroll individuals through the exchange, and this is true for the businesses or for individuals, you will have to take this training class and certification class, which is coming up in this June-July time period. And there's really a couple of advantages for that. One, we want to make sure that everybody knows exactly what we're talking about. And this does get a little complicated, and anytime you get into tax incentives and tax programs, it can get a little bit complicated. So we want to make sure everybody is well aware of what this looks like. Two, we want to make sure that the broker community is very comfortable using the site. So it's a brand new site, and there's going to be lots of places to click and enter information. And in order to service your clients better, we want to make sure you have some opportunity to go through and kick the tires and really find out what that looks like. And then third is, any broker or producer who goes through and takes these training classes, they'll be listed in an online database that's searchable by name, address, agency, so that consumers who require that kind of help can go through and find the broker in their area, and that listing will be open to the public. Certainly our call center will have access to that. So for any individual who's interested in finding a producer to help them, if they've taken our class, they can go ahead and find that information very quickly and easily.
We have a question here.
We have a small business, and we currently offer health insurance through one of those providers that you listed, but not all of our employees are signed up under that program. Are they going to be able to be signed up separately under this program?
Go ahead.
So if I understand the question correctly, you currently offer a plan, but not all your employees are looking to take advantage of that.
Correct.
So for the most part, and I'll generalize a little bit, and then maybe we'll get into some specifics. Sometimes employers offer health insurance. Not all their employees accept it because they might have coverage through a spouse or some other means, and that's why they're not accepting the coverage that you have. In other instances, they're just refusing it and going without coverage. So come October 1st, per the Affordable Care Act, it is a law that all Americans will need to hold health insurance for the year. And so if your employer is offering insurance and you refuse it, you would be subject to the penalty. Now, there are some exceptions around that. And this really relates, and Phil, keep me honest here, this relates to the cost of that insurance offering to the employee versus some parameters that the government has set up that quantify or qualify a plan as being affordable. So if the offering is deemed unaffordable, an individual can get what's deemed a hardship waiver, and then they are eligible to go on to the exchange and purchase a plan. If the insurance is affordable per this, this litmus test, but the employee simply just refuses to get it, then they're not eligible to come on to the exchange, and they would be subject to the penalty.
Can I?
Yeah, please.
Here's where I'd like to, just to clarify a couple things. You mentioned that you were a small employer. When you go to a carrier, they have their requirements as well. So you have to have a certain amount of participation from your employees. It hasn't been fully defined yet if, because as Jason mentioned, there are times where there's waivers. Spousal waivers, spouse works at another company, there might be a TRICARE waiver for somebody in the military, Medicare waiver, things like that. So the carriers are defining right now what they'll also allow for waivers, and the assumption would be obviously that participating in an exchange would be a waiver, but you'd have to make sure that the carrier is defining that, because that's their rule, nothing to do with us. The other thing, to just clarify a little bit on what Jason was saying, was there are penalties, but that's really going to be determined by the size of your company. So a company that has 50 or more full-time equivalents, and I say equivalents as opposed to employees, is going to have one set of rules, and companies with less than 50 full-time equivalents will have another set of rules. So depending on the size of your company, I obviously don't know your full circumstance, you may or may not have those penalties applied. So I hope that answers your question. Yep.
Phil, is the penalty for the employer or the penalty for the employee who chose not to take advantage of it?
There's both.
Okay.
So as Jason mentioned, as of January 1st, 2014, every American must have health insurance, and if they don't, there is a penalty component to that. But to answer about employers, if a employee of an employer goes to an exchange and applies, and they have certain criteria about affordability, 9.5% affordability, and what they call 60% of actuarial value. If the employer doesn't match that and the employee goes into the exchange and gets a subsidy, then the employer will be getting a bill from the exchange.
So if the employer is doing everything appropriately,
then there's no.
then they're fine.
Okay. It's
All right.
great clarification. Exactly.
Question? I'll come right back to you.
We'll get to you.
What about individuals that are currently getting their health care through the VA system? Will they still be required to get health care through this?
Again, as long as you're showing that you have coverage through government or private industry, somehow that you have insurance coverage, then you're good. So there's no changes there.
There you go. Got it.
I actually have a couple of questions. First question is, you talk, your chart in here talks about income. Is that gross or net?
It's the modified adjusted gross. That's typically, I think it's
what
the
you
last box on the front side of your form.
So it's what is claimed on the federal?
That's correct. Correct.
Okay. Second question is?
Box 1 on your W-2.
Box 1?
Yep.
Second question is, can that, for someone who loses their job, can they go on this as opposed to taking COBRA? And then if they get another job, drop this and go on their employer's health insurance? Because when they lose their job, they don't have insurance.
Right. No, the short answer is yes. So if you did lose your job and your income goes to zero, you could go to the exchange and apply. And certainly I think for many individuals in that circumstance, the rates on here would be wildly more affordable than the COBRA options, which I think typically run about 120% of the employer's premium price. If you then get a job within that period and that employer offers insurance, again, if that coverage is deemed credible, as Phil just mentioned, you would then drop that plan and sign up for the coverage through your employer.
And could you drop it at that time, or would you have to continue paying until the open enrollment?
Yeah, I believe that's one of those qualifying life events that would allow you to go ahead and make that transition.
Yeah.
There you go.
I'm Norris Christensen, a broker, and I work with a lot of small business clients. Yep. Under our present system, most carriers charge higher rates for the smallest businesses, and depending on your number of employees, the rates improve. Will that system continue in the future, or does that get changed?
No, that's going to change. Currently, there's a load for small businesses of about 15%, I'm going to say. That's going to go away under this system. So that changes. Does that answer your question? Or, and as Jason said, as there's a spread of the 5 to 1 and male, female, and where you are in the state. If you're in Fairfield, you're paying 5% more.
3 to 9, 10 to 15, all becomes
one, it's composite rated. Yep. Does that answer? Yeah.
We have a question on this side. There you go.
Hi there. I'm Dr. Michael Goodman. I'm Medical Director of New England Urgent Care, and we have a few urgent cares in the state. I have the disadvantage of being an emergency physician who's running these urgent cares. And one of the things that I've found that is, first of all, I'm very happy that more people are getting insured. That's I think, a laudable goal. But the problem that I'm seeing is that with the Affordable Care Act, the Medicaid rules are that only family practice internists and pediatricians can get the increased fee schedule for Medicaid.
Right.
And then that's going to preclude anybody else from allowing them to run a medical practice that would see Medicare beneficiaries. It's, I think, going to penalize the Medicaid beneficiaries because there's going to be a lot of people who are not going to take their insurance. And so it'll be still an obstacle for accessibility to health care.
Yeah, I wouldn't necessarily disagree with what you said. You know, from the exchange's perspective, that's not an area from a policy standpoint that we opine on or have the authority to oversee or make changes to in terms of provider arrangements for the Medicaid program. Certainly, as we set our system up and set up the marketplace, we'll be determining eligibility, but unfortunately some of those issues are just, they're outside of what we're addressing.
Will the products that are available be equivalent? Will people have to say, okay, I'm at this level of income, I have to take Medicaid as opposed to taking one of the other products? Will the other products be subsidized sufficiently so that they can take the other product rather than being forced to take Medicaid?
Yeah, if you are deemed eligible for Medicaid, you will not be eligible for any sort of incentives for the other products. So it's at that 138 mark. If you're eligible below that, you can't make the decision to not accept that, but then try to get a tax incentive to make a commercial plan more affordable, unfortunately.
That's unfortunate.
I'm waiting for a hand over here. While we're going over there, what can we be doing? We're representing a Chamber of Commerce here, so we're specifically geared to getting information to our small businesses, which is the majority of our particular chamber. Right. What can we be doing now to help get the word out? How can we partner? How can we get this information out? Quick, easy answers. Do you have emails coming out, newsletters coming out, other than the chats? And then I'll walk over here.
Yeah, no, I appreciate that. Go ahead. Right now, we have several different programs in place, and more to come in terms of educating individuals and giving them access to information. One of the best ways, quite honestly, is to do things in person. And so, the better part of the last 6 months has really witnessed Access Health Connecticut, going back and forth across the state to hold a series of healthy chats, much like we're talking about here. And we've done those on a pretty grand scale. We partnered with the local NBC affiliate to advertise these, have them professionally moderated, had them at larger venues, and literally touched thousands of folks throughout that process to engage with them directly. I think, given the complexity of this law and the implementation, many times it's a lot easier to go through the types of questions and issues in person rather than handing out a brochure or a flyer. With that said, Phil and I and others can only be in so many places at once, and so there's other more scalable programs that will be coming out in terms of getting information out. One of the best ways is through videotaping some of these sessions, and we've got a whole library of content that we're going to be posting on our own YouTube channel so individuals can actually come and attend an event like this virtually through that experience. We're going to be coming out with a whole series of different tutorials and webinars which we'll be posting on our site, and those will really be geared towards educating folks on just the basics of the Affordable Care Act. That'll be called the ABCs of the ACA, if you will. We're also going to be producing a series of, call them quasi-testimonials, where we're going to be profiling individuals in certain types of circumstances. These might be on the individual side as well as on the business side, so folks can get a more tangible idea of how this is actually going to start affecting people in very particular circumstances. I think over the past 2 years, you've seen information come out at the 50,000-foot view, but certainly now that the law is here to stay, we're past any sort of election and Supreme Court decisions, the most common questions we get from folks is, how does this physically affect me? And so it's a very personal choice at this point in time, and so much of the information that's going to be coming out is really going to be geared towards that. So please check the website. Please sign up for our email distribution, which will be a primary means of getting information out, and much more to come to make sure that there are electronic resources available that you can direct people you know, employees, friends, colleagues to get more information.
And if I could just interject on that, if I was an employer, and I've dealt with small employers for over 20 years as a producer, broker, and what I was recommending to the people that I was working with is to really start educating yourself in terms of what is coming, which sounds simple, but it isn't. And then the other thing I would recommend strongly is, if you're a small employer, I'd start counting your people to know exactly how many people you have, because there is things, there are parts or components of the law that affect you, as I was referencing earlier, excuse me, whether you're 25 or 50 employees, it does make a difference, and I would start counting that. And Jason referenced it earlier, we are going to be working with broker groups such as the National Association of Health Underwriters, which is NAHU, which is a group. We're also going to be working with the Chamber Insurance Trust, which is another organization that does a lot with small employers. So there's a lot coming out, but I would stay close to a trusted advisor who really knows this, because as we've referenced again and again, this is complicated stuff. It's doable, we'll get you there, but certainly that would be my thing, please.
Regarding employers, can you clarify as to whether it will be an option for employers to offer health insurance to their employees? Will it become law that they have to?
Well, that's a simple one. The law only addresses the individual mandate, which means that it's an individual's responsibility to get the insurance. We saw this up in Massachusetts. It was an individual mandate, so the employers were not necessarily penalized. Employees or individuals had to report it and then get themselves squared away. So it's an individual mandate. Everybody's responsible for their own, either through an employer or through the government. Through the military, things like that.
So it is an option for employers?
Depending again on the size of your group, well, no, so very simply, no, it is an option for an employer. It is up to the individual to get their own insurance. It's, in terms of employers, it becomes a paternalistic thing. Do you want to have good employees and keep them by offering the insurance is another whole issue.
Just to kind of tag on her, though, if as an employer you don't, will you be charged, penalized?
Yeah, so if you are an employer, and right now in Connecticut, the line of demarcation is fewer than 50 or more than 50. If you have fewer than 50 employees, you are not required to provide insurance to those individuals. We hope that small firms in that range will, and as we mentioned, there are these tax incentives in place, which hopefully will make it more attractive for individuals who aren't currently providing it to make the choice to go ahead and provide it, and for those who may have been on the fence or are currently having difficulties providing it, hopefully again those types of incentives will actually make it more attractive for them to keep doing so. The tax incentives themselves for that under 50 group really relate to being able to get an additional tax credit moving forward. Right now it's at 35%, but for up to 50% of the premiums that employer is actually contributing, or the cost of the premiums that the employee is covering on behalf of the employee. So it can add up to a fairly large number number fairly quickly. On the 50-plus side, to Phil's point, you don't have to provide insurance, but if you don't, there actually is a penalty on a per employee basis that equates roughly to about $2,000 for each employee. So, an employer in the 50-plus category is going to need to make the individual choice to determine whether or not it makes sense for them to pay the penalty or whether they prefer to, offer the insurance. Again, there's very, a paternalistic streak that tends to happen here, but that's going to be, each company's going to have to crunch the numbers themselves and find out what they, what's in their best interest.
Okay, and I had one other question. I'm trying to wrap my brain around all of this. So there's the exchange that an individual or an organization will have an opportunity to get insurance, and then there's still insurance brokers, agents that you can still go, okay. But if you choose to go that route, then you're not eligible for tax credits.
No, I'm glad you brought that up. That's actually a key point of clarification. If you as an individual or a business choose to utilize the services of a broker, which we think a lot of people will, and you sign up through the exchange, the individual still gets access to the tax credits, whether they're an individual or a small business, and the broker still gets a commission on that sale.
But they've gone through the exchange.
They've gone through the exchange. That's exactly right.
Okay, but then the last question is, if you're an LLC, no tax credits.
Not necessarily. Why?
Oh, did I misunderstand that? Because
The tax credits, no, I think what you might have heard me say, okay, so the tax credits are available to groups with 25 or less employees, small employers, obviously, and the calculations for seeing or if you receive those tax credits, there's specific formulas for that. And one of the things is that you need to take out the members who are LLC members, subchapter S members, so maybe you misunderstood. I apologize. Yeah, those are excluded in terms of the formula, but it's employers with less than 25 employees. English is a funny language.
What happens if you move? Let's say you move out of the state.
Yep.
And you signed up through the exchange as an individual, and then you move to New Hampshire or North Carolina.
If you move, that is one of those qualifying life events. You'd be able to have, I guess that's sometimes referred to currently today as a special election period, but you'd be able to reevaluate and make a different choice at that point.
Can you stay in the exchange even though you're not in Connecticut?
You could. You could. Yep. Yep.
Any other questions? And while I'm walking down, we have a question here. The number of full-time is a full-time equivalent, and maybe you want to address that.
Okay. So again, that English is a funny language thing. So we've all been kind of indoctrinated to full-time employees, but there is a new equation that's just come out. The IRS just finished the comment period on this in March 18th. So what it addresses is the fact that you need to look at the number of employees that you have, which include full-time employees, which is 30 or more hours, also part-time employees. And you need to add all those employees up to determine whether you have over 50 full-time equivalent employees. Once you get to the 50 full-time equivalent employees, you then disregard your part-timers, and then you have to determine whether now it becomes an issue of which employees may or may not go into the exchange, get a subsidy, and therefore you might have a penalty, as Jason was referencing, or a tax, or a penalty of $2,000 on average. So does that answer that question? I know it's clear as mud sometimes, but so that's what the full-time equivalent has to do with. And you have to also start doing that as of 2013. You have to start doing it. So if you have a producer or a broker that you're working with, I would strongly suggest that you work with that broker to make sure that you understand, because I don't want to get too far into the reeds, but it does become complicated because it's full-time equivalents based on full-time and part-time, but it also has to do with how long those employees were working for you. And there's administrative periods. There's, I see people shaking their heads going, yeah, I understand. So I would strongly recommend that you work with somebody on that.
Did you say if you had no life event, you still have to re-roll every fourth quarter?
In terms of If you haven't had any sort of life-changing events over the course of the year, October comes again. I don't know the mechanics of that renewal process. I know today, currently, in the individual market, if you have a plan, you're happy with it, it can many times just auto-renew and keep going. I'd have to get back to you. I don't know the specifics on whether you need to come back to the exchange during that period and simply reapply for the same product, or whether there is that automatic renewal. I'd have to get back to you on that.
I think a concern that I have heard in small business is that the small business that is so strapped for time and doing so much will need an attorney and an accountant to get through all this. And that's, if there's any way that you could use the chambers or the public libraries or something to help the small business get through this hump, because it's, we're talking about the full-time equivalent. It's a calculation, and, when do you have time to do that when you're doing all the other small business jobs? And
it's a great point, and I'd say just a few things. So one is, we're glad to have Phil here because we do look forward to putting together a very robust program to reach out to producers across the state to make sure that they are, excited, engaged, up to speed on the exchange, so that they can go out and service their clients or even service new clients who they currently don't do business with, given that everybody has to have coverage. And so we are very committed to making sure that that program is up and running. The second is, you mentioned tax professionals, lawyers. We're in the process of thinking about how to engage those individuals as well. I think for many small businesses, for choices like this, they're not making them alone, and they do rely on a network of professionals to help them evaluate these things. And so we want to make sure that that entire surrounding support network is also up to speed. I know I just had my own taxes done, and my accountant looked at my W-2 and said, "Oh, you work at the exchange. I have a lot of questions for you." So it took me a little longer this year to file my taxes than normal, but yeah, that's right. That's right. The other thing that we're looking forward to doing as well is, certainly over the course of the summer months, we're going to have a very robust outreach education program in place that will rely a lot on in-person events, certainly while the weather's nice. Certainly here in New England, once we get to October, it gets dark at 3 o'clock, and, it's not exactly the prime time to hold outdoor events. But we will be staging many education and enrollment opportunities throughout that fourth quarter. So if there's a small business that does not have a relationship with a producer or does not have a relationship with an accountant, that they can come somewhere, get information, and actually have access to those types of resources in a location so they can go through that process. The same exact thing goes for individuals. We want to make sure that, if they're confused, as may be the case, that they can show up at physical locations and have access to folks who can actually help them make this choice.
How will this work with health savings accounts now, and how might that be affected?
Turn that over to me. So the exchange actually will have a health savings account plan attached to it. It's going to be the bronze plan in this case. So just as it works with a health savings account now, you would create that medical, you choose that medical provider, carrier, and then you'd have to set up a health savings account through a financial institution just like you would today. So that could continue. So you could, if you have one now, you can continue to use it. And they're, as you know, they're great because they do allow you to not only pay for the medical services, but also the vision and dental and all that kind of good stuff. So does that answer the question? Just that there will be one, I guess is the bottom line.
keep going, you're good. We have one more question here.
That's
and
totally fine.
We're here. We got
We're
one
going to be
here,
till 9
one
o'clock
here.
tomorrow morning.
There you go.
Is hitting 65 considered a major life event?
For who?
And when you do that, do you, I mean, what about the rest of your family? Do you keep the insurance you have through the exchange and it becomes your supplemental insurance? What about your other family members? When you go on Medicare, what happens exactly?
Yeah, so again, so the exchange, when the law was written, has to do with people who are under age 65. It does not have to do with Medicare or Medicaid, or Medicare SUP, I should say. So people who have the insurance and they turn 65, then you have that option of then going Part A, Part B, but the people who are under 65 still have that requirement under the law to have insurance through, again, either through the exchange or through their employer or a government entity. So, so those people would still be responsible under 65.
So it'll happen like in the middle of the year, the whole family sort of just...
Well, it's a qualifying event, obviously, because again, just like it's a life-changing event for a lot of reasons. But you would have to then determine, you know, where those people who are under 65 are going to, how they're going to, you know, depending on their situation, end up back having coverage. They'll have to have it.
Effectively, Medicare will not change.
There's no change to Medicare as it stands today.
Okay.
So that's the entire law had to do with, as I say, people who are under 65.
Okay.
There are some changes to the Medicare program, particularly with regards to Medicare Advantage programs. I think those have even been delayed in terms of the changes, but under the law, no.
Question? Oh, there we go. There we go.
Hi, I'm Chris O'Neill from Granby. Thank you for letting the North folks come down here south today. The first question, you've used a phrase or a word repeatedly today, producer. For people who aren't in the know on that, what is a producer? And how is that different from a broker?
Okay, so, and that's partly my problem, my issue, because in the state of Connecticut, the law actually calls brokers and agents producers in the law, so I sometimes refer to that. So what I'm talking about is a licensed life and health broker. So a life and health broker is a person who generally is licensed with all the carriers and can help somebody determine, you know, which carrier is best for them. Traditionally, an agent is only licensed with one carrier and kind of works for that carrier. Generally speaking, when you're dealing with health insurance, particularly, you're really dealing with a broker. And I would say the majority of brokers in the state of Connecticut are licensed with all the health insurance carriers.
Thank you. So if somebody's looking for a local producer, they'd actually look for a local broker or a local agent?
Correct.
Thanks.
Correct. And I will change my verbiage in the future.
The other question I had is, are there still 2 carriers planning to join the market in Connecticut, and will they only be available through the exchange?
So Jason referenced I think what you're talking about is the co-op, which is the Healthy Connecticut, which is a new carrier being formed as we speak. Initially, that's being formed under the guise of the Connecticut State Medical Society, but it is a consumer-friendly group, and that is just being started to be created. And then we did hear that Harvard Pilgrim is also planning from Massachusetts to come into the state. So that still is in all the works. My understanding is there's a gentleman by the name of Mickey Herbert who used to be the president of HealthNet, and Connecticut has been hired by them to represent them in the state of Connecticut. So as far as I know, both are in the works.
Will they only be through the exchanges?
No, I think you know, say Harvard Pilgrim will be just like Connecticut and Anthem and all, still available to everybody.
Any other questions?
We have just one.
No, that's all right. No worries.
Thank you both for coming out tonight. I'm Joe Scheiman, a partner with Robert Hensley & Associates, and I'm a producer and an agent. Is there a likelihood of a conflict? So you had mentioned if a small business, less than 25 employees, participates and provides coverage to their employees through the exchange, the small business gets a credit. If an individual goes directly to the exchange, they would get a subsidy on the policy they would be purchasing. But if a small employer offers a qualifying plan, the employee doesn't have the option to go to the exchange and purchase coverage on their own. Is there an opportunity where an employee could go do some research on their own and come to the employer and say, you know, if you didn't offer a plan with my subsidy, it would cost me less than the plan that you're providing to me now? Should we begin to think and prepare for those sorts of scenarios, or is that all kind of being tended to on your side?
I think this actually just goes to the calculus that individuals and businesses will have to do. So, right now, obviously, we don't know what the price of the plans are going to look like. We don't have that information. So once that comes out, I would imagine that businesses and employees would actually be doing that exact math to find out what might be best for, both sides of that equation. Without the specifics, it's hard, but I would actually envision that many people are going to be doing that exact same math.
And I'm not sure if I heard you correct. Did you say there's a penalty for the small employers?
No, but
Okay.
what I said is a small employer, if they offer a qualifying plan, their employee does not have the option of purchasing an individual plan on the exchange, correct?
Right. I just want to make sure that because again, that gets back to that 50, over and under 50 with the penalties. I just want to make sure people understand that.
Thank you.
Any more questions? I think we've got them all. Any closing remarks?
No, I would just say, again, thanks so much for coming out. I know we all have extremely busy lives. We've got families and jobs and loved ones, and to come out and spend an hour and a half talking about health insurance, I really, really appreciate it. So thanks for your interest, thanks for your time, and we hope to continue the dialogue. Thank you.
And I just wanted to say, yes, thank you to Jason and Phil. Access Health Connecticut. The website is www.accesshealthct.com. It's got a lot of information. Definitely go and check it out. I want to thank SCTV for taping today. Althea, thank you very much. Thank you all for coming. Thank you.
Thank you.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.